Okay, chapter 24 talks about evidence-based practice in nursing research. I'm sure y'all have heard a lot about it. What is evidence-based practice by now? And generally, it's a problem-solving approach to clinical practice that integrates a systematic search for and critical appraisal of the most relevant evidence to answer a burning clinical question. One's own clinical expertise and a patient preferences and values. I know I said a lot. So again, basically what we're looking at overall is just what the evidence support. What is in a systematic way based on the most relevant evidence. How could we improve patient care? So it's a systematic method of applying research to findings to nursing practice. We can incorporate many additional all sorts of data. Again, uh, evidence on which nurses practice based on derived from synthesis of knowledge from research, data analytic for medical records, quality improvement, risk data, infection control data. So we're looking at how can we improve care in a nutshell. So when we look at evidence-based practice, it's derived from international, national, and local standards, looking at pathophysiology, cost-effective analysis, benchmarking, patient preferences, and again, clinical expertise. So step one, we're going back to that old nursing process again. We're going to define the problem. We're going to identify, review, evaluate the data, looking at quantitative or qualitative method or mixed method. These are some research designs. Then again, the step three, design a practice change based on the data. Again, we used to a long time ago. Before inserting a folic catheter, we used to inflate the balloon. But based on the most relevant evidence, recent evidence or evidence-based practice, there are evidence to say that the balloon may have been contaminated or may have been a flaw in the balloon based on inflating it prior to inserting it into the client. So the evidence say we do not inflate the balloon prior to inserting it. Okay. And then based on the evidence-based practice, we can implement changes in our nursing practices. So we stopped inflating the balloon, and so this is a change in the way we practice. The need for nursing practice based on research. Again, we need it because if not, we can increase healthcare costs, scrutiny on how client healthcare can dollars are spent, payment based on favorable patient outcomes. So this we need that research. Okay. So again, there are two methods: nursing research utilization and again evidence-based practice. So we need more evidence. Nursing research utilization. Steps of research utilization. Step one, pre-utilization, assessing, planning. Step four, implementing, and step five, evaluating. We can look at peer reviews, research reports. So these are experts for consideration to be published in peer-reviewed scholarly journals. So we do. If you there are a lot of journals out there. There are journals that specifically to our areas of practices. So research utilization, it is based, it's not simply using findings of a single study. Studies are replicated. Data are collected in a process method in the process. So how do we use that research in practices? From conducting research. Conducting research, this is what ways of knowing. Like I said, we collect that data in a systematic approach. We gather the data to answer specific research questions. So what do we do? Utilizing research, we integrate it into way of doing things. We look at that. So as we talked about, some of you got an opportunity to do your select a theorist, and based on that theory, we use nursing theories as a theoretical framework for research study. So if you wanted to say use one of your theories that you can integrate that theory into your research. So look at what that theory, the framework of that theory is, and how can you utilize it in today's nursing. Florence Nightingale, you can use that into, you have an issue, look at the problem. So whatever theories that you use, like I told you guys, if you select the theories now, if you want to do research further along, you've already identified a theory that you're comfortable with. So you can build on that knowledge. So again, that research finding will support the theory or suggest modification of the theory while you're focusing on nursing practice. National Institute of Nursing Research, it serves as a major source of federal funding for nursing research. It supports nursing education and research career development, excellence in nursing science. And also the National Institute established national nursing research agendas. So you have specific topics, a priority topic just for nursing research based on the Nursing Institute. And this is your link, the website for, it's a government website. Always remember your credible website is going to end in .gov. Okay, it's one of the credible websites. I will put it that way. Agencies for healthcare research and quality. Like I said, this is one here. www.ahrq.gov. This is the Agency for Healthcare Research and Quality. It conducts and supports general healthcare services, develop clinical practice guidelines, disseminate their research findings and guidelines to healthcare providers, policymakers, public, to the public. And also, at the Agency for Healthcare Research and Quality supports evidence-based practice centers programs, which also help develop reports about intervention based on public scientific studies related to healthcare. So again, healthcare research, nursing research, evidence-based practice is very popular now because we're looking at the most relevant research. Like I said, it changes the way we practice things we do. This policy helps support policy change. So we just don't change a process. We collect data. We determine the need to change based on the most relevant evidence. Okay, so that was very short. This is again just some more material that just reinforces what you already know about evidence-based practice. So again, this ends the presentation.